handouts or review materials must be treated with utmost confidentiality. It shall be the responsibility of the person whose name appears therein that the handouts or review materials are not photocopied or in any way reproduced, shared, or lent to any person or disposed in any manner. Any handouts or review materials found in the possession of another person whose name does not appear therein shall be prima facie evidence of violation of RA 8293. Top-notch review materials are updated every 6 months based on the current trends and feedback. Please buy all recommended review books and other materials.
Okay, now, so let's move on to your mouth. Okay? Sa mouth, no, wala naman masyadong questions about sa mouth. However, there are questions about about the salivary glands, no? Okay? And it is important how to differentiate them anatomically and histologically. Okay? So, you have 3 major salivary glands. You have a parotid gland, a submandibular or submaxillary gland, and a sublingual gland. Okay? The largest of which is the parotid gland. Okay? Yan yung, ayan, tinatap natin, no? Pag, gusto nating i-elicit ang Vostek sign. Okay? It is the largest. Okay? The smallest is the sublingual gland. Okay? However, ang may pinakamaraming ambag, no, sa laway mo is your submandibular gland. It produces 2/3 of all the saliva. Okay? Submandibular gland. Okay? Your parotid gland is located at the retromandibular space, no, between the ramus of the mandible and the mastoid process. Okay? While your submandibular gland is at the submandibular triangle. Okay? Remember, it is transformed, no, into 2 portions by your mylohyoid. Transformed talaga, okay? Or divided, no? Divided by the mylohyoid into superficial and deep portion. Okay? While your sublingual gland lies above the mylohyoid, above the floor of the mouth. So, your parotid gland, yung mnemonic natin kanina, no? Parotid, cranial nerve, 9, no? Babalik na rin. Okay? While your submandibular, sublingual glands, S, no? S, 7, no? 7th cranial nerve. Okay? In terms of histology, okay? Histology. Your parotid gland, okay, are branch acinar glands, okay? In contrast to the 2, yung dalawa, branch tubulo-acinar gland. Your submandibular, sublingual, branch tubulo-acinar glands, okay? Your parotid gland is purely serous, okay? It is a purely serous gland. While your submandibular is a mixed gland, however, serous sila, no? Predominantly serous. Okay? While your sublingual is also a mixed gland but mainly mucus. Okay? So if you look at it, pag serous gland, ganito ang kulay niya, no? Dark pink. Okay? Pag mucinous, usually yan, mga white. Okay? So ito, mix silang parehas, pero ito mas white, no? Kasi more of mucus gland siya. Okay? In terms of the ducts, okay, your parotid gland, okay, saan siya nagde-drain? Okay, saan dumadaan ang saliva niya? Through the Stenson's duct. Okay, Stenson's duct. Okay, your submandibular, okay, ang saliva will pass through the Wharton's duct. Okay, while your sublingual gland, although smallest, dalawa ang ducts. Okay, the duct of Rivinus and the duct of Bartholin. Okay, so those are the things that we need to know about your salivary glands. Okay, now, so let's go with your, tapos na tayo sa eyes, sa mouth, sa ears. Okay, sa nose, wala naman masyadong important. No? So, let's go to your neck. Okay, so sa neck, ang usually favorite nila, no? And what you need to know are the triangles of the neck, okay? There's no easier way for you to remember the triangles of the neck except to draw it, no? So, get a piece of paper, get 1/4, get 1/4, no? Let's try to draw the triangles of the neck, okay? Sundan niyo ako, okay? So, first, let's draw a square or rectangle, yan. Okay? So, depende sa lapad ng ano mo. Depende sa lapad ng leeg mo. Okay? Sa akin, rectangle. Okay? So, let's label. Okay? So, the upper part is the mandible. The anterior part is the midline of the neck. The inferior part is the clavicle. Okay? The posterior part is the trapezius. Okay? Oh, nahirapan na. No? Yan pa lang. Okay? So, square pa lang tayo. Okay? Wala pang triangle dyan. Okay? Okay? And next, okay, draw another rectangle here. Okay? That will be your hyoid bone. Okay? And then, okay, draw a line from one end ng rectangle mo to the other end. Okay? So, that will be your sternocleidomastoid. Okay? So, ngayon, meron ka ng dalawang triangle, no? Isa ito, isa ito. Okay? So, ayan, isang question na yan, no, sa board exam. What structure divides the anterior and posterior triangles of the neck? Okay? That will be your sternocleidomastoid. Okay? Yan, 1 point. Okay? Sternocleidomastoid. Okay? Next question. Okay? What are the boundaries of your anterior triangle of the neck? Okay? Ayan, alam mo na yan. Kasi ito, midline of the neck, mandible, okay? SCM. Okay? Tama? That's anterior triangle. Okay, 2 points. What are the boundaries of your posterior triangle of the neck? Okay, so you have SCM, trapezius, the clavicle. Okay, tama? Okay, so yan, no, in text. Okay, same lang yan. Yun yung binanggit ko, no? Okay, so yan, meron ka ng 2 triangles. However, meron ka pang mas maraming triangles. Okay, so next, you draw the digastric. Okay, so digastric, this is your anterior belly of digastric. This is your posterior belly of digastric. Okay, anterior belly, posterior belly. Okay, and then draw the omohyoid. This is the superior belly of the omohyoid. This is the inferior belly of your omohyoid. Okay, gets natin? So, sa anterior triangle, you have 1, 2, 3, 4. Okay? So, anterior triangle has 4 triangles, while your posterior triangle has 1, 2. 2 lang, no? 2 posterior triangles. Okay? So, that's it, no? Ayan na yan. Labelan na lang natin. So, this will be your submental triangle. Okay? Submental triangle. So, if I ask you, no? What are the boundaries of your submental triangle? So, the midline of the neck, the hyoid bone, the digastric, no? Anterior belly of digastric. Okay? Ayan na yun. Okay? So, your submental triangle contains the submental lymph nodes, no? And vessels. Okay? Yan lang mga important content niya. So, next, okay? You have the digastric triangle. So, what are the boundaries of your digastric triangle? Okay? So, anterior belly ng digastric, saka posterior belly ng digastric. Kaya nga siya tinawag na digastric triangle. Okay? As well as the mandible. Okay? So, that is your digastric triangle. Ang other name niya is submandibular triangle kasi nasa ilalim siya ng mandible. Okay? And ano ang contents, no? The contents, okay, ang important lang is the submandibular gland. Okay? So, yon. Next, your carotid triangle, what are the boundaries? So, this is the posterior belly of the gastric, the SCM, and the superior belly of your omohyoid. Okay? So, that's the carotid triangle. Okay? Ano ang content? Important, the carotid sheath. Okay? Carotid sheath. Okay? Malalaman natin yung specific na structures pa within the carotid sheath later. Okay? So, your carotid triangle contains the carotid sheath. Your muscular triangle, what are the boundaries? The midline of the neck, superior belly of omohyoid, the SCM. Okay? Ang other name niya is omotracheal triangle. Okay? Okay? It is muscular because andyan yung sternohyoid, sternothyroid. Okay? Ano pa ang nandyan? The trachea, the thyroid gland, the parathyroid glands. Okay? Those are the contents of your muscular triangle. While in your occipital triangle, nandito ang boundaries pala muna, no? SCM, trapezius, omohyoid, inferior belly. Okay? So, contents, ang important is your brachial plexus, nandito sa occipital triangle. So, kung gusto mong saksakin yung katabi mo at gusto mo, ayaw mo siyang mamatay, brachial plexus lang gusto mo tirahin, dyan natin sasaksakin. Okay? Favorite itanong niya, no? Natanong na yan before, no? Nasaan ang brachial plexus? It is at the occipital triangle. Okay? While your supraclavicular or subclavian triangle, kaya siya supraclavicular, it is above the clavicle. Okay? Ano pa palang boundaries? SCM and inferior belly ng omohyoid. Okay? Ang contents, supraclavicular lymph nodes. Okay? So, ito ay, from visual mnemonic, no? From the internet. Okay? So, basically, that's it lang din. No? Okay? This is the actual view, no? Of your triangles of the neck. Okay? You can look at that on your handout. Okay? But for me, the easiest way to remember is through the diagram, no? Okay, so basically, these are the contents of each of the triangle. Okay, this is lifted from Moore, no? So ayun lang din yung mga sinabi ko, no? Okay, so ayun lang din. Okay. Okay, now, so let's talk about, one of the 4 plexus that we will discuss. Okay, your cervical plexus. This is actually a minor plexus in your body lang, no? Okay? Always remember, pag mga plexus, it is always composed of the ventral rami or ventral ramus. Okay? So for this case, your cervical plexus is coming from your C1 to C4. Okay? It is joined by connecting branches, okay, which lie in front of the origins of levator scapulae and scalenus medius. Okay? Okay, so always remember in the muscle relation ng muscle, no? Muscle relation, okay? Kung saan na-form ang mga plexus. So in this case, levator scapula and scalenus medius. Okay? So for this plexus, I will not encourage you to draw, no? Kasi yung cervical plexus, it is a minor plexus nga lang. And it is very complicated, no? Ayan, no? Mahirap i-drawing. This is the actual, drawing of your, drawing of your cervical plexus. Medyo magulo siya, okay? So, konti lang naman yung branches niya. So, we will just remember, na. Okay? Important lang dito, actually, ayan, ito mga ito, no? So, to start, we have the lesser occipital nerve, okay? The lesser occipital will supply the scalp behind the ear. Okay? So, this part. Okay? Hawakan mo, no? Lesser occipital. So, greater auricular over the parotid salivary gland in the angle of the jaw. Ayan, dito, no? Greater auricular. Lesser occipital, greater auricular. Okay? Your transverse cutaneous is over the side and front of the neck. Okay? And your supraclavicular, upper part ng chest and shoulder. Okay? Lesser occipital, greater auricular, transverse cutaneous, supraclavicular. Okay, ayan na yun, no? Tapos na. You also have segmental branches to supply your prevertebral muscles and levator scapula. Okay? Your ansa cervicalis will supply your omohyoid, sternohyoid, and sternothyroid. So, these are your infrahyoid muscles. Okay? However, yung isang infrahyoid is supplied by your C1 via hypoglossal nerve. Okay? That is your thyroid. Okay? So, all infrahyoid muscles, okay, are supplied by ansa cervicalis except thyrohyoid, okay, which is supplied by your C1. Okay? Your genuhyoid, okay, is also supplied by your C1 via hypoglossal nerve. Okay? And your phrenic nerve, okay, C3, C4, C5 to supply the diaphragm. Okay? Kaya ang mnemonic, di ba? 3, 4, 5 keeps the diaphragm alive. Okay? 3, 4, 5 keeps the diaphragm alive. Okay? So those are the branches of your phrenic nerve. Okay? Your phrenic nerve also has sensory branches, no? That will supply the pericardium, the pleura, and the peritoneum. Okay? So, ayan, ito ang sensation of the of the head and neck. Remember, the face, supplied by the cranial nerve 5, no? This is V1, V2, V3. So the rest, okay, your greater occipital nerve is not part of your cervical plexus, ha? Okay, so it will supply the posterior part of the head up to the upper back. Okay? Ang part ng cervical plexus, ito, no? Lesser occipital nerve at the back of the ear, your greater auricular nerve over the parotid area and over the mandible. Okay? Your transverse cutaneous nerve sa anterolateral neck and your supraclavicular nerve, okay? Supraclavicular area. Okay? Yan. So that is your cervical plexus, na? Kaya natin, cervical plexus, na? So now, let's go to a major artery coming from your neck, no? The subclavian artery. Okay, your subclavian artery, yung right is a branch of brachiocephalic, okay? While yung left is a direct branch of the arch of aorta. Okay? It is divided further into 3 parts, no, by the anterior scalene. Okay? So this is the arch of the aorta. Okay? The arch of the aorta has 3 branches. Okay? The brachiocephalic trunk, the left common carotid, the left subclavian. Okay? So the left subclavian is a direct branch, no, of the arch of the aorta, while your right subclavian is a branch of the brachiocephalic. Okay? So yun. So as mentioned, it is divided by the anterior scalene. Scalenus anterior into 3 parts. Okay? The first part, okay, is coming from the origin of the vessel up to the medial margin ng anterior scalene. Up to the medial margin ng anterior scalene. Okay? The second part is directly behind, no? Directly behind the anterior scalene. Okay? The third part, okay, is from the lateral margin of the anterior scalene to the outer border of the first rib. Okay? Kasi pagdating dito, it will become the axillary artery na. Okay? So, those are the parts of your subclavian artery. And each part has a branch. Okay? So, from the first part, okay, that is the origin of the vertebral artery. Okay? We've already discussed the vertebral artery extensively a while ago. Okay? The second branch is the thyrocervical trunk. Okay? So, this is the thyrocervical trunk. Your thyrocervical trunk branches further into the inferior thyroid artery to supply the thyroid gland. Okay? You also have a superficial cervical artery and suprascapular artery. Okay? So, that's the thyrocervical trunk. Okay? You also have a third branch, okay? Your internal thoracic artery, no? Which will supply your thoracic wall, okay? It will further branch out into superior epigastric artery and musculophrenic. Okay? So, ito ang internal thoracic artery, okay? It will branch out ito, no? Superior epigastric and wala dito, no? Yung musculophrenic artery. Okay? So, 3 branches ang first part. Vertebral, thyrocervical, and internal thoracic. Your second part, okay, is has 2 branches, okay? The costocervical trunk, okay? Ito, no? Costocervical trunk, okay? And the deep cervical artery, okay? Not seen here, okay? Your costocervical trunk will give off a superior intercostal artery, no, to supply the first and second ICS. While your deep cervical artery will supply the deep muscles of the neck. Okay, so the second part has 2 branches, the costocervical and deep cervical arteries. While your third part has no branches. Okay, your third part has no branches. If there is, no, pag meron siyang branch, it is the dorsal scapular artery. Okay? Sometimes, may mga deviations from the normal. Your superficial cervical and suprascapular artery, minsan nanggagaling sila sa third part. Okay? But, okay, originally, the third part has no branch. Okay? So, we're done with the subclavian. We'll go to your common carotid artery. Okay? Your common carotid artery ascend within the carotid sheath. Okay? And divide again at the level of C4, no? Kasi nga bifurcation. Okay? So it will divide into external and internal carotid arteries. Okay? Few structures that we can see in your common carotid are your carotid body, okay, which lies at the bifurcation of the common carotid artery. Okay, your carotid body is a chemoreceptor, no? So it participates in your chemoreceptor reflex, no? Which you will learn in your physiology. Okay? And you also have the carotid sinus, okay, a spindle-shaped dilatation at the origin of the internal carotid artery. It is a presoreceptor or a baroreceptor, so it participates in your baroreceptor reflex. So, ayan, no? This is your brachycephalic trunk. This is subclavian artery. This is the common carotid artery. Okay? Your common carotid will divide to external and internal. Ito yung carotid sinus, a dilation at the origin in your internal carotid. Okay? So, the external carotid artery, it begins at the level of the upper border of the thyroid cartilage and terminates in the substance of the parotid gland behind the neck of the mandible, okay, by dividing into the superficial, temporal, and maxillary arteries. So those are the terminal branches, okay? So external carotid, okay, the terminal branch, okay, is superficial temporal, okay, and your maxillary artery. Okay, another picture. So these are the branches of the external carotid. Okay, this is the terminal branch, superficial temporal. This is the maxillary artery. Okay, so these are the branches of your external carotid artery. Okay, starting with your superior thyroid artery to supply the thyroid gland, of course, the infrahyoid muscles, SCM, and larynx. Your ascending pharyngeal artery will supply the pharyngeal walls. Your lingual artery will supply the tongue. Okay? Your facial artery will supply the tonsils, submandibular gland, and the muscles and skin of the face. Okay? While your occipital artery supplies the back of the scalp. Okay? Your posterior auricular will supply the auricle and the scalp. Okay? And your superficial temporal artery will supply the scalp as well, while your maxillary will go to the deep structures of the face. Okay? So let's trace each, no? So this is the external carotid. Okay? This is the superior thyroid artery. Okay? This is the ascending pharyngeal. This is the lingual, supply the tongue. This is the facial artery. Okay? This is the occipital artery to supply the scalp. Posterior auricular artery. Okay? The maxillary artery, okay, and the superficial temporal artery. Okay, so those are the branches of your external carotid artery. Remember pala, no? Your superior thyroid is coming from the external carotid artery, while your inferior thyroid artery is coming from your subclavian artery. Specifically, the first part. Okay? So your internal carotid artery, we've already discussed a while ago. Okay? In the neck, wala siyang branches. No? Thank God. No? Walang i-discuss. Okay? So, yeah. Okay? So now, okay, let's discuss the thyroid gland. Okay? So, we're still in the neck, no? The thyroid gland, it is the largest endocrine gland. Okay? Around 25 to 40 grams, and it's slightly bigger in women than in men. Okay? It arises as epithelial invagination at the base of the tongue. Okay? So, starting sa foramen cecum. Okay? Mabubuo siya doon. Okay? Coming from your endoderm. Okay? And then, magdedescend siya sa neck. So, your thyroid gland, okay? So, these are the parts. You have the lateral lobes, right and left. Okay? Lateral lobes. You have the isthmus. Okay? And then, your isthmus sometimes, okay, it remains connected for a time to the base of the tongue through the thyroglossal duct, no? If naging pathologic, nagiging thyroglossal duct cyst, okay? dapat nagdi-disappear siya, no? So your isthmus is at the level of the second and fourth tracheal rings. So this is your isthmus. It connects the right and left lateral lobes. Okay? Sometimes, meron kang remnant ng thyroglossal duct. Okay? Okay? This is your pyramidal lobe. Okay? Usually in the left. Okay? Usually in the left siya. Okay? And minsan, okay, yung pyramidal lobe, okay, it remains attached to your hyoid bone. Okay? Not represented in this picture, no? Pero minsan, meron pang attachment sa hyoid bone. Okay? Hyoid bone. Okay? That will be called the levator glandulae thyroidae. Okay? Levator glandulae thyroidae. Okay? In the tongue, okay, you can appreciate the foramen cecum. Okay? It indicates the point of origin of the thyroid gland. Okay? So initially, your thyroid gland is at the oral cavity. Okay? It is located at the apex of the V-shaped furrow, okay, which is your sulcus terminalis, that separates the anterior 2/3 of the tongue from the posterior 1/3. Okay? So the original location of your thyroid gland is at the foramen cecum. You also have a thyroid, the histology, no? So the thyroid gland has an outer capsule, okay, and has a true capsule, okay? Your true capsule will invaginate inside to form septae, okay, to form your follicles, okay? And within the follicles are homogeneous gel-like materials, okay, known as the colloid. Okay? So we cannot see the the capsule, but you can see the septae, okay? Septae, ayan, mga septa yan, okay? And then you have a lobule, okay, which contains follicles, okay? And the follicles will contain a homogeneous material, okay, known as the colloid. Okay? So your thyroid gland has two types of cells, okay? You have a follicular cell or thyrocytes and a parafollicular cell, okay, or mitochondria-rich cell or C cell or clear cell. Ay, daming other name, no? Okay, your follicular cells or thyrocytes are coming from the endoderm, okay, thyroglossal duct origin, while your parafollicular cells are coming from your fourth pharyngeal pouch, okay, it is coming from the neural crest. Okay? Majority of the cells that we see in the thyroids are follicular cells. Okay? Okay, which functions to produce T3 and T4. Okay? Your follicular cells will secrete T3 and T4, while your parafollicular cells will secrete calcitonin. Okay? Kaya nga siya C cells. C cells for calcitonin. Okay? So, saan mo makikita ang follicular cells? Usually, it surrounds the follicular lumen and exposed to the luminal surface. However, your parafollicular cells, okay, are located at the periphery in the connective tissue. Okay? Later pa yung picture. Okay? In terms of histology, more of histology ulit, the follicular cells are smaller, more basophilic, with a dark nucleus and 2 to 3 prominent nucleoli, with microvilli. Okay? While your parafollicular cells are larger, lighter staining, with pale nucleus without microvilli. Okay? They're also round. No? Okay? Your follicular cells, they vary. Okay? The shape varies according to the functional state. Okay? If it is active, they are taller. No? They are low columnar. Okay? But if it is hypofunctional, they are flat, no? They are simple squamous. So this is a thyroid follicle containing colloid. So saan mo makikita daw ang follicular cells? It surrounds, no, the follicle. Okay? So andyan yung mga follicular cells. Okay? Saan mo makikita yung parafollicular cells? Nasa connective tissue, nasa periphery. So ayan sila. Okay? So yeah. Okay? The blood supply of the thyroid gland is favorite. Okay? Very favorite. Okay? You have a rich blood supply. Okay? Your superior thyroid artery as mentioned a while ago, is coming from the external carotid artery. Okay? While your inferior thyroid artery is coming from your thyrocervical trunk, coming from your subclavian artery. Okay? Ito pa, no? Favorite, madalas ding itanong, the artery that is not always present in your thyroid gland, it is the thyroidea ima artery. Okay? If you have, okay, it will arise from the brachiocephalic artery or the arch of the aorta. Okay? So this is the superior thyroid artery coming from the external carotid. Your inferior thyroid artery coming from the thyrocervical trunk of the subclavian artery. And your thyroidea irma artery. So this time it's coming from the brachiocephalic artery. Okay, so it will supply the isthmus and not always present. Okay, so this next important thing to discuss are the laryngeal nerves. Okay, in relation to your arteries. Okay, usually tinatanong pag nagta-thyroid surgery, no? Okay, so the thyroid arteries and important nerves. Okay, you have an external laryngeal nerve. Okay, it is accompanied by the superior thyroid artery. Okay, asan siya? External laryngeal nerve. Okay, malapit siya sa superior thyroid artery. Okay, tama? Okay, it will supply the cricothyroid. Okay, it will supply the cricothyroid and inferior pharyngeal constrictor. Okay, your cricothyroid is responsible for tensing the vocal cords. Okay, so if you inadvertently ligated the external laryngeal nerve, okay, so mawawalan ng supply si cricothyroid, you will be unable to tense your vocal cords. Kung hindi mo siya ma-tense, you will not be able to register high notes. Okay? Hindi ka na makakabirit. Okay? Yan, no? So, goodbye, Regine, no? Yan. So, that is your external laryngeal nerve. Your recurrent laryngeal nerve, okay, asan siya? This is your recurrent laryngeal nerve. It comes with the inferior thyroid artery. Ayan, yan sila. Okay? Your recurrent laryngeal nerve supplies the intrinsic muscles of the larynx except the cricothyroid because cricothyroid nga is supplied by external laryngeal nerve. It provides sensation below the vocal cords. Okay? Sensation below the vocal cords. Okay? So, it supplies the intrinsic muscles. So, if you inadvertently injure your recurrent laryngeal nerve, wala kang intrinsic muscles ng larynx. So, wala kang boses. Hoarseness. Okay? So, yun lang yan. While your internal laryngeal nerve, ito, internal laryngeal nerve, kaso wala yung artery, no? Hindi kita. It is accompanied by the superior laryngeal artery. Okay? It provides sensation above the larynx. Okay? And taste fibers to the epiglottis. Okay? So, if you inadvertently injure your internal laryngeal nerve, okay, you will not feel anything above the larynx. Okay? So, kung may food dyan, magdadare-diretso siya, hindi ka makakapag-gag reflex, no? Magdadare-diretso siya sa trachea. So, you will have aspiration. Okay? So, injury to the internal laryngeal nerve, okay, you will have aspiration, recurrent aspiration. Okay? Nakakalito, no? But if you enroll in the top-notch program, no, meron tayong song about this, no? Hindi siya makakalimutan. Okay? Ayan, nag-promote na. Okay? So, I encourage you, hindi ko ituturo today, but ituturo ko during the, review proper. Okay? So, meron tayong mnemonic song, okay, for this. Okay? During the top-notch program proper. Board's review proper. Okay? So, let's go to the parathyroid glands. Okay? Your parathyroid glands, usually two pairs. You have two superior and two inferior parathyroid glands. Okay? Important to remember the gross appearance. Okay? So, because recently, ayan, tinatanong ang gross appearance. It is yellowish brown. Okay? It's tiny ovoid bodies at the posterior surface of the thyroid gland. Okay? It lies within the capsule of the thyroid gland as well. Okay? And the inferior parathyroid, okay, is coming from the third pharyngeal pouch, while your superior parathyroid is coming from the in fourth pharyngeal pouch. Okay? So, ang mnemonic ko dyan is TIFs. Okay? TIFs. Okay? Third, inferior. Fourth, superior. Kasi nakakalito siya. Okay? So, third, inferior. Fourth, superior. So, these are the cells that we can see in your parathyroid glands. Okay? So, you have a chief cell or principal cell. You also have an oxyphil or acidophil cell. Okay? More numerous ang principal cell or chief cell. Okay? Less numerous ang oxyphil cell. Okay? Both of them are polygonal. However, larger is the oxyphil cell. And they can be found individually, clustered in groups. Okay? And both of them with eosinophilic cytoplasm. Okay? In terms of function, your chief cells will secrete PTH, while your oxyphil cells, okay, has unknown function. Okay? So these are the principal cells. Ayan. Okay? These are your oxyphil cells. Ito, in groups sila. Ayan, in groups. So now we're just done with your anatomy and histology of the neck. So we'll go to the thorax. Okay? So first off, we need to discuss the bones that comprise your thorax. Okay? So one of the most important ones is your sternum. Okay? Your sternum is a flat bone, okay, and has several parts pa. Okay? You have a manubrium, okay, which lies at the level of T3 to T4. Okay? Your manubrium has a jugular notch, okay, which is the superior margin, no? It can be readily palpated here, okay? That is your jugular notch, okay? You also have clavicular notches, so right and left, okay? Okay, that part will articulate with the body. That part will articulate with the clavicle, okay, to form your that part will articulate with the clavicle to form your sternoclavicular joint. Okay? And your manubrium will articulate inferiorly with your body of the sternum to form the manubriosternal joint or the sternal angle or the angle of Lewis. Okay? So, ayan, the manubrium articulates with the first costal cartilage and second costal cartilage. Okay? So, this is your sternum. Okay? Detached. So, this is your sternum. Okay? Attached to the clavicles and the costal cartilages. So, you have a clavicular notch, a jugular notch, okay, and the clavicular notch here. Okay? This is the manubrium. Okay? This is the manubriosternal joint. Okay? Or your sternal angle. Okay? Your body of the sternum, okay, on the other hand, okay, it articulates with the second to seventh costal cartilages. Okay, only. Second to seventh only. Okay? And it also articulates with the xiphoid process to form your xiphisternal joint. Okay, which lies at the level of T9. Okay? And lastly, the most inferior part of your sternum is the xiphoid process. Okay? Its tip lies at the level of T10. Okay, so initially it is a thin plate of cartilage, and as you grow old, it becomes ossified, no, to become a bone. So this is your body. Okay, this is your xiphoid process. So between the body and the xiphoid is your xiphisternal joint. Okay, which lies at the level of T9. Okay, T9. Dito siya, no? While your xiphoid process, its tip lies at the level of T10. Okay? T10. Okay? One important thing about the sternum is the sternal angle of Lewis. Okay? Or the manubriosternal joint or manubriosternal angle. No? It is the biggest crossover, no, in your body. Okay? Why? Dami nagaganap dyan. No? Okay? It is an important surface landmark of what? Okay? First, your manubriosternal joint or sternal angle, okay, corresponds to the second costal cartilage. Okay, that is the level of your second costal cartilage. Okay, so kasi you use your second costal cartilage, no, for auscultation, di ba, of the heart. Okay, your T4 to T5 IV disc. Okay, posteriorly, your sternal angle corresponds to T4, T5. So pag itong angle na to, if you go posteriorly, okay, it lies at the level of T4, T5. Okay? It also forms it is at the level of, it is the same level, no? Ng junction ng ascending aorta and aortic arch. Okay? So, again, no, from the left ventricle, magiging ascending aorta. Okay? Your ascending aorta will end at the sternal angle of Louis. So, yung end ng ascending aorta, sa sternal angle. Okay? And yung start ng aortic arch, sa sternal angle din. Okay? Yung aortic arch will also end, no, at the level ng sternal angle, okay, to become the descending aorta. Okay? So, your aortic arch, the start and end niya is at the level ng sternal angle. While your bifurcation ng trachea is also at the same level, no? The sternal angle. And your sternal angle, if you draw a line at that part, okay, up to the posterior border, okay, up to the posterior part, okay, T4, T5, okay, mahahati ang mediastinum, no, into superior and inferior mediastinum. Okay, we'll see that, we'll discuss the mediastinum later. So, those are the happenings, no, at the sternal angle. Ang dami nagaganap. Okay? So, one important artery in the thorax is your internal thoracic artery. Okay? Which is responsible for the supply of the anterior wall of the body from the clavicle to the umbilicus. Okay? It is a branch of the first part of your subclavian artery. Okay? And it will end, yung terminal parts niya are the superior epigastric and the musculophrenic arteries. Okay? So, this is your subclavian artery. This is your internal thoracic artery. Okay? To supply the anterior thorax. Okay. So, your internal thoracic artery has several arteries pa. Your anterior intercostal. Okay? To supply the intercostal spaces. You have perforating arteries. A pericardiophenic artery. Okay? To supply the pericardium, pleura, and diaphragm. You also have mediastinal arteries to supply the anterior mediastinum. And the terminal branches, which are your superior epigastric artery, okay, which enters the rectus sheath, no, to anastomose with the inferior epigastric artery, and your musculophrenic artery. Okay, so those are the branches of your internal thoracic artery. Okay, again, this is the subclavian artery. Okay, this is the internal thoracic. Okay, the terminal branches are musculophrenic and the superior epigastric artery. So that's your internal thoracic artery. Okay, next. Okay, so as mentioned earlier, we have the cavity within your thorax. Okay, it is named as the mediastinum. Okay, so let's first identify the boundaries of your mediastinum. Okay, superiorly, okay, this will be the thoracic outlet and the root of the neck. Okay, so everything here is the mediastinum. No? So superiorly, the thoracic outlet and the root of the neck. Inferiorly, it is bounded by the diaphragm. Okay, anteriorly, it is bounded by the sternum and the transversus thoracis muscle. Okay, posteriorly, the vertebral column. Okay, and laterally, not seen here, are the pleural cavities. So, the lungs are not included in your diaphragm. Okay? So, the lungs are not included. So, your mediastinum, okay, so we know now the boundaries, but still it is further divided into a superior and inferior mediastinum by an imaginary plane passing from the sternal angle to the, okay, between T4 and T5. Okay? So, ito ang mediastinum mo. Sabi natin, a line transecting from the sternal angle to the T4, T5. IV this. Okay? So, yan ang that's what divides the mediastinum into a superior portion and an inferior portion or inferior mediastinum. However, your inferior mediastinum is still further divided into middle, anterior, and posterior. Okay? The middle mediastinum, okay, is consists of the heart and the pericardium. Okay? And anything that lies between the pleural cavities. Your anterior mediastinum, okay, is the space between the pericardium and sternum. And the posterior mediastinum is the space between the pericardium and vertebral column. Okay? So this is your pericardium. So anything related to the pericardium and heart, okay, is located in the middle mediastinum. Okay? Anterior to it, andyan ang anterior mediastinum. Posterior to that is the posterior mediastinum. Okay? So these are the boundaries of the superior and inferior mediastinum. Okay? So anteriorly, the manubrium, T1 to T4, the first rib, and the imaginary line. Okay? So the superior mediastinum, ito sila, no? So manubrium, the T1 to T4 vertebra, okay? Followed by ito, no, the imaginary line, okay? Superiorly, the root of the neck. Okay. Inferiorly, ayan, imaginary line. This is T5 to T12 vertebra, okay? The body of the sternum, okay? And the diaphragm. Okay? So this is the actual picture. Yan, ito ang middle mediastinum, dito ang posterior mediastinum, dito ang anterior mediastinum. Okay, this is on the other side. Anterior, middle, posterior. Okay, this is superior. Okay? So each mediastinal part, okay, has its own contents. Okay, again, hindi ko babasahin lahat, na mabobore lang kayo. Pero let's highlight the important parts, okay? First, your thymus. Okay, your thymus, nakikita mo siya dito, no? It lies in the anterior mediastinum. Okay? However, sometimes it can extend to the superior mediastinum, no? It depends kung gaano kalaki ang thymus mo, okay? But it is originally located in the anterior and may extend to the superior mediastinum. Okay? Just remember sa middle mediastinum, anything related to the heart, okay? Or anything that's coming or anything that is draining towards the heart, okay? So coming from the heart, the ascending aorta, no? Okay? And then the superior vena cava will also drain in the heart. Okay? So, ito pa ang kailangan nating tingnan, no? So, from the heart, magbibigay ng ascending aorta. It is in the middle mediastinum. Tama? However, di ba? At the level of the transverse thoracic plane, that is at the level of the sternal angle, T4, T5, magiging arch of aorta na siya. Okay? Magiging arch of aorta. Nasa superior mediastinum na siya. Tama? And then, yung arch of aorta, magiging descending aorta, no? Pero, bababa siya sa posterior mediastinum na. Okay? So, your ascending aorta, nasa middle. Yung arch, nasa superior. Yung descending, nasa posterior mediastinum. Okay? Did you get it? Okay? Yung arch of aorta and its branches, no? Nasa superior mediastinum, yung brachiocephalic artery, left common carotid, and left subclavian artery. Okay? Ito pa tingnan natin. The phrenic nerve, okay? From the superior mediastinum, di ba, from C3 to C5, nerve roots, it will form the phrenic nerve sa superior mediastinum. Bababa siya ng middle mediastinum. Okay? Yung vagus nerve, from the superior again, sa likod siya pupunta. So, sa vagus nerve, yung sa posterior mediastinum. Okay? Your trachea, no? Your trachea, so nasa superior mediastinum. Okay? And then, it will bifurcate, tama? Bifurcate at the level of T4, T5. Okay? So, nag-bifurcate na siya dito. Okay? Your esophagus, again, coming from your superior mediastinum, pupunta siya sa posterior mediastinum. Okay? And then, eventually, to enter the stomach. Okay? So, those are the important details, okay, in terms of the contents of your mediastina. Okay, now, so let's discuss the thymus. Okay? The thymus is a flattened bilobe structure, okay, It lies in the anterior mediastinum, no? Anterior mediastinum, but it may extend to the superior mediastinum, okay? Because of its large size, no, in the newborn infant, okay? It continues to grow until puberty and then eventually undergoes involution, okay? Grossly, it looks like, or it appears as a pink lobulated organ, okay? And it arises from the third pharyngeal pouch, okay? How to remember? Third for thymus, third thymus, okay? Third pharyngeal pouch, okay? It produces thymosin for differentiation and maturation of T lymphocytes, okay? So this is your thymus, okay? Bilobe, okay? And pink lobulated in appearance, okay? In front of the heart, okay? In your thymus, you can see a specific uh, histologic feature, okay? It is actually the most distinctive feature of your thymus, okay? It is the Hassal's bodies or Hassal's corpuscles or the thymic corpuscles, okay? So it is here, okay? The Hassal corpuscle, okay? It is a core of hyaline material, okay? Surrounded by layers ng flat epithelioid cells, okay? So as you grow old, nag-i-increase ang number ng thymic corpuscles, okay? So it's a unique feature of your thymus. Okay, so let's go to the trachea. Okay, your trachea is a mobile cartilaginous and membranous tube, no? Beginning at the level of C6. Okay, level of C6 cricoid cartilage. Okay, and it will end at the level of T4 to T5, no? To bifurcate and to right and left main bronchi. Okay, ang tawag dun sa end niya is the carina. Okay, so in terms of length, 4.5 inches long, okay, and 1 inch in diameter. So 4.5 inches ang haba, 1 inch ang taba, okay? And it is kept patent by the 16 to 20 incomplete U-shaped hyaline cartilaginous rings, okay? And it is deficient posteriorly, okay? It is deficient posteriorly, okay? What's good about the hyaline cartilaginous rings? It provides a semi-rigid, no, structure for your trachea. Semi-rigid, okay? Semi-rigid, it provides rigidity, okay? To prevent collapse. At the same time, semi-rigid lang, no? So that it will be able to expand, no, once you inhale air. Okay? So this is your trachea, okay? At the level of C6, 'di ba? Start ng trachea. And then ito yung mga C-shaped rings, deficient posteriorly, okay? So in contact siya with the esophagus. And then it will end at the level of the carina, okay, to become the main bronchus. Okay? So your carina is at the level of T4, T5. Okay? So one thing about so nandun na tayo sa bronchus, no, after the trachea. So one thing about the bronchus, main bronchus, okay, the right is totally different from the left. Okay, hindi symmetric ang ating mga bronchus, main bronchus. Okay, always remember that the right main bronchus is wider, shorter, and more vertical. Okay, wider, shorter, more vertical. Okay, around 1 inch lang siya, no? As compared to the left main bronchus, that's narrower, longer, and more horizontal. Okay, around 2 inches. Okay, remember itong signal ko na ito, no? So your thumb represents the right main bronchus. Your index finger represents the left main bronchus. So ano napansin nyo? Your thumb is wider, no? Compared to the index. It is shorter and it is more vertical pag ginawa mo ito. Okay, so that represents the right main bronchus. Okay? So, the right main bronchus, siya lang ang merong eparterial bronchus. Okay? Anong ibig sabihin? Okay? Because your right main bronchus, before it enters the right lung, mag-give off na siya ng superior lobar bronchus. Okay? So, ito ang right main bronchus mo. Bago pa siya pumasok ng hilum, may binigay na siya. Okay? Na isang lobar bronchus. The right lobar superior lobar bronchus. Okay, that is called the eparterial bronchus. Eparterial, it is equivalent to superior lobar bronchus, only seen in the right, no? Only seen in the right lung. The rest, okay, will be given off after it enters the hilum. So your middle and inferior lobar bronchus are hyparterial bronchus. Okay? While sa left main bronchus, walang issue. No? Yung dalawang lobar bronchus niya, i-give off niya lang as it entered. No? As it enters the hilum. Okay? So your right main bronchus, it runs under the arch of the azygos vein. Okay? Right main bronchus under the arch of the azygos vein. Ito yung azygos. No? While your left main bronchus, okay, passes to the left below the arch of the aorta and in front of the esophagus. Ito yung esophagus. Ito yung arch of the aorta. Ito yung left main bronchus. Okay? So, that's it about the main bronchi. Let's go to the lungs. Okay? So, your lungs, okay, has an apex. Okay? The apex which projects upward into the neck for about 1 inch above the clavicle, while your base sits on the diaphragm. Okay, so your apex is directed superiorly, your base is inferiorly located. Okay, it has a costal surface, okay, which lies in contact with your chest wall, and has a mediastinal surface, okay, molded to the pericardium and other mediastinal structures. Okay. The depression, okay, on the medial part of each lung is known as the hilum, okay? It serves as, okay, as a passage for your bronchus, for your vessels and nerves, no, to enter and leave the lung. You also have a cardiac notch, okay, on the left, no, on the left lung, okay? So this is your right lung, this is your left lung, okay? So this is your hilum on this part. No? So your right lung, and so your right lung is larger and heavier, but also shorter and wider. No? It is larger and heavier because it has 3 lobes. No? It has 3 lobes. Ayan, no? It has 3 lobes. Superior lobe, middle lobe, and the lower lobe. Okay? However, it is shorter and wider, no? Because, sinong sisisihin natin? Si liver. So, the right lung has 3 lobes, the upper, middle, and lower lobes. Okay? And it is divided by 2 fissures, oblique and horizontal or accessory fissure. Okay? It is divided into 10 segments. Okay? 10 segments. And it has grooves for the superior vena cava, the arch of azygos, and esophagus. Okay? On the other hand, your left lung has the lingula and the cardiac notch. It has 2 lobes, okay, and only has 1 fissure. Okay? Several references, nag-aaway-away. Okay? Lagay na lang natin pareho, no? It has 8 to 10 segments. Okay? And has grooves for the aortic arch, the descending aorta, and the left subclavian artery. Okay? So, this is your right lung. Again, this is your left lung. This is the horizontal fissure. This is the oblique fissure. Okay? Your oblique fissure is seen on both lungs. Okay? While your horizontal fissure is only seen on the right lung. Okay? The cardiac notch, okay, and the lingula is only seen at the left lung. Okay? The cardiac notch and lingula is seen only in the left lung. Okay? So now let's move on, no, to the types of cell that we can see in the in each lung, okay, in the lungs, okay? Histologically, you have 2 types of cells, okay? Your type 1 alveolar cell and your type 2 alveolar cell, okay? This was recently asked, no, in the 2021 board exam, okay? 1 question for each, no? A type K question. Okay, so please remember, no? Always remember this slide. So your type 1 alveolar cells, okay, other name, pulmonary epithelial cell, the small alveolar cell or pneumocyte type 1. Okay? They are squamous cell. So basically, they have flattened nuclei. And it is the predominant cell that we can see in your lungs. Okay? It line almost the 95% of the alveolar surface. Okay? It functions as a barrier, no? However, it also allows gas exchange. Okay? It is the main site for gas exchange. Okay? That is the type 1 alveolar cells. Your type 2 alveolar cells, okay, also known as the great alveolar cell or the pneumocyte type 2. Okay? Type 2. Okay? Kung ang type 1, squamous, flat, okay, your type 2 are round, okay, with large nucleus, okay, and plentiful eosinophilic cytoplasm. Okay? It only occupies 5%, okay, of the surface area of the alveolus. Okay? It will contain lamellar bodies, okay? And yung lamellar bodies will contain the surfactant, okay? Your lamellar bodies will contain the surfactant, okay? So the main function of your type 2 alveolar cells is to produce surfactant, okay? So this is the alveoli, sorry. In low magnification, this is in high magnification, okay? So this is the type 1 pneumocyte, no? Flat cells, okay, with flat nuclei. Okay, while this is the type 2 pneumocyte, no? Round cells with round nuclei and eosinophilic cytoplasm. Okay, type 1 for gas exchange, type 2 for surfactant secretion. Okay, another type of cell that we can see in your airway is your club cell or Clara cell. Okay, these are non-ciliated cells in the epithelium. Okay, previously asked din, no, in the board exams. Okay, predominantly we can see this in the respiratory bronchioles. Okay, so mga nasa distal part na bronchioles. Okay, and it has 3 functions. Okay, number 1, okay, to secrete the other components of your surfactant. Okay, so it also helps in the formation of your surfactant. They also function as stem cells, no, for regeneration, and it also has its own cytochrome P450 system, okay, that acts to detoxify noxious substances. Okay, so those are your Clara cells. Okay, so yan, Clara cells, no, walang cilia, no, non-ciliated, and you will see them in the respiratory bronchioles. Okay? And lastly, your pulmonary alveolar macrophages. Okay? Most numerous cells in the alveoli. Okay? And you can see them, okay, floating freely in the alveoli. So, dyan sila, no, sa loob ng alveoli. Okay? Because they act as the first line of defense, no? They act as the avid scavengers, no, for pathogens. Okay? Once it phagocytoses dust, okay, ang tawag na sa kanya, dust cells. Okay, dust cells. So your pulmonary alveolar macrophages, once it phagocytoses dust particles, it will become dust cells. Okay? And yung lineage nila, they come from your monocytes. Okay? They come from your monocytes. Just like any other macrophage in the body. Okay? So let's go to the covering of your lung. Okay? Your lung has a pleura. Okay? A thin serous membrane consisting of a parietal and visceral pleura. Okay? So let's discuss each. Okay? The parietal pleura is the outer surface. Okay? So the outer part of the pleura is the parietal pleura. Okay? It will line the surface of the thoracic wall, okay, and the mediastinum. And it is further divided into a costal, diaphragmatic, mediastinal, and cervical parts. Okay? While your visceral or pulmonary pleura, okay, dips into the fissures of the lung, okay, directly investing, no, the lung. Okay? In terms of arterial supply, your parietal pleura has internal thoracic, superior phrenic, posterior intercostal, and superior intercostal arteries. Okay? While your visceral pleura is supplied by your bronchial arteries. Your parietal pleura is drained by the corresponding veins. Okay? while your visceral pleura is drained by your pulmonary veins. Okay? In terms of innervation, your parietal pleura is innervated by intercostal nerves and your phrenic nerves. Okay? Depends na lang no kung saang part ng pleura. Okay? But intercostal and phrenic nerves innervate the parietal pleura. Okay? While your visceral pleura is innervated by autonomic nervous system. Okay? So, specifically the pulmonary plexus. Okay? That's why your visceral pleura is not sensitive to any type of pain. Okay? And will only be sensitive to stretch stimulus. Okay? In contrast to your parietal pleura, it is sensitive to pain, temperature, touch, and pressure. Okay? So your pleuritic type of pain, okay, para sa mga pleural pathology, no? Okay, is sa mga pneumonia, okay, it is coming from the parietal pleura. Your parietal pleura also forms the cupula in the upper part of your pleura, okay? And it also forms the pulmonary ligament, no? Yung medial part ng pleura, okay? Closely related to the hilum of the lung. Okay, so this is your parietal pleura, which has several parts: the costal part, the mediastinal part, okay, the diaphragmatic part, okay, and the cervical part, which forms the cupula. Okay, next, okay, your pericardium, no? So let's go to the heart, okay? So you have a pericardium that covers or encloses the heart and the roots of the great vessels, okay? It functions to restrict excessive movements of the heart. At the same time, it acts as a lubricated container, no? Because it has pericardial fluid, okay? So that the heart can efficiently contract. It lies in the middle mediastinum, no? As mentioned, anything related to the pericardium and heart, it will lie in the middle mediastinum, okay? And it is innervated by the phrenic, vagus nerves, and sympathetic trunk. Okay? Your pericardium, again, was asked, no, in the previous exam. Okay? Your pericardium still has several layers. Okay? Starting from the outermost, okay, your fibrous pericardium. Okay? So it is a strong, dense fibrous layer. Okay? And it is firmly attached to the central tendon of the diaphragm. Okay? So the outermost is the fibrous pericardium. It is followed by the serous pericardium, which is further divided into two. Okay, you have parietal layer and a visceral layer. Okay, so your parietal layer, okay, will line the fibrous pericardium. Okay, and then you have a pericardial cavity in between. And then, after the pericardial cavity, you will see the visceral layer of the serous pericardium. Your visceral layer, okay, will form the epicardium of the heart. Okay, so it is equivalent to the epicardium of the heart. Okay, let's look at it. So this is your fibrous pericardium, no? The outermost, okay? This is a fibrous part, strong part. Ito na, fibrous pericardium. It is followed by the parietal layer, okay? The parietal layer. Itong parietal layer. Followed by the pericardial cavity filled with pericardial fluid. Okay? It is followed by the visceral layer of the serous pericardium, which is equivalent to the epicardium. Okay? So that is your pericardium. So let's go to the surfaces of the heart. Okay? So you have several surfaces, okay? Starting with the sternocostal, okay? That is equivalent to the anterior surface of the heart, and it is formed by the right atrium and right ventricle. Okay, right atrium and right ventricle. Your diaphragmatic surface, okay, is equivalent to the inferior surface of the heart, okay? Which is composed by the right and left ventricle. The base or the posterior surface is formed by the left atrium, and the apex is formed by the left ventricle. Okay, and take note of the direction. It is directed downward, forward, and to the left. Downward forward and to the left. Okay? And yung apex lies at the level of 5th ICS left, 3.5 inches from the midline. 5th ICS left, 3.5 inches from the midline or at the midclavicular line. Okay? So, these are the surfaces of the heart. So, sabi natin, sternocostal surface, the anterior surface is formed by the right atrium and the right ventricle. The diaphragmatic surface is formed by the right ventricle and the left ventricle. Okay? The base, ito ang base ng heart, it is formed by the left atrium. Okay? And the apex is formed by the left ventricle. Okay? You also have borders of the heart best appreciated in an X-ray. Okay? So you have a right border or the acute border. Okay? So which structures form the right border? Okay? Ito na, right atrium, the SVC, and your IVC. Okay? So that forms your right border or your acute border of the heart. Okay? It is followed by, ayan, we also have a left border. Okay? So the left border is formed by the auricle, left auricle, then the left ventricle, ayan lang, no? Left auricle and left ventricle. Okay? Left or obtuse border. The inferior border is not appreciated, no, in an X-ray. Okay? But it is formed by the right ventricle and right atrium. Okay? Right ventricle and right atrium. While the apex is formed by the left ventricle. Okay? So those are the borders of the heart. Okay? Now, going to the layers of the heart. Okay? So you have 3 layers. Okay? You have the epicardium, which is equivalent to the visceral layer of serous pericardium. It is the most external layer of the heart, followed by the myocardium, okay, followed by the endocardium, which is the most internal layer of the heart. So your epicardium is equivalent or synonymous with the visceral layer of the serous pericardium. Okay? The myocardium happens to be the thickest layer and composed of cardiac muscle fibers. Okay? It is thickest in the left ventricle, okay, and thin in the atria. Okay? Since the ventricles produce more work, no? Okay. So it needs to be thick, no? And lastly, your endocardium, okay, which is continuous with the innermost layer of the great vessels, and it covers all the internal surfaces of the heart. So going back to this picture, you have a fibrous pericardium, okay, followed by the parietal layer of the serous pericardium, the pericardial cavity, okay, followed by the visceral layer of the serous pericardium or your epicardium, okay, the thickest layer, myocardium, okay, and the innermost layer, endocardium. Okay, so let's go to the chambers of the heart. So for the chambers, for the purpose of short discussion, we'll discuss the right atrium and right ventricle only. Okay, because the left ventricle, left atrium, no, nangopya lang sila ng features, no? Meron lang unique features, right atrium and right ventricle. Okay? Pero we will differentiate later, no? Each one of them. Okay? So your right atrium, you have a main cavity. Okay? You also have a right auricle, a conical muscular pouch, okay, or ear-like projection, okay, which covers the first part of the right coronary artery. Externally, you will appreciate a vertical groove. Okay, tinanong na ito, no? Sulcus terminalis. Okay, a vertical groove on the external surface of the right atrium. Okay, and it marks the junction of the primitive sinus venosus. Okay, and you also have a crista terminalis. Okay, it is the counterpart of your sulcus terminalis. However, your crista is found internally. Okay, it is found internally. So, external, sulcus terminalis. Internal, crista terminalis. Okay, it provides the origin of the pectinate muscle. Okay, and it also represents the junction between the sinus venosus in the right atrium proper. And you also have the pectinate muscles, okay, which are prominent ridges in the atrial myocardium. Okay, so ito, the ridge inside the right atrium, okay, that is the crista terminalis. Okay, these roughened muscle fibers are the pectinate muscle. Okay, so your ear-like conical projection, muscular pouch, okay, this is the right auricle. Okay, and you also see the right atrioventricular orifice guarded by the tricuspid valve. Okay, and you also see the fossa ovalis, no? A remnant of your foramen ovale. Okay, fossa ovalis. Okay, so those are the features of your right atrium. So what structures open in your right atrium? You have the superior vena cava, the inferior vena cava, guarded by the eustachian valve, the coronary sinus, guarded by the Tevesian valve, okay, and the right atrioventricular orifice, and the foramina venarum minimarum cordis. Okay, so you have 5 openings in your right atrium. Okay, so your superior vena cava, okay, your inferior vena cava guarded by the eustachian valve, okay, and the opening for the coronary sinus guarded by the Tevesian valve, okay, and ito pa, another opening, the opening right atrioventricular orifice guarded by the tricuspid valve, okay, and not seen in this picture yung foramina venarum. Okay, you can also see the fetal remnants, okay, of your right atrium. Okay, the fetal remnant that we can see in the right atrium is the fossa ovalis. Okay, it is shallow oval shape depression in the interatrial septum, and this the site of the previous foramen ovale in the fetus, no, which allows passage of blood from the right atrium to the left atrium, no, bypassing the lungs. Okay, on the upper margin of the fossa, you can appreciate, no, the annulus ovalis. Okay, so in here, this is the fossa ovalis. The upper margin, okay, is called the annulus ovalis. Okay, so those are the unique features of your right atrium. Okay, so we'll go to the right ventricle. Okay, so your right ventricle also has an infundibulum. Okay, or other term is the conus arteriosus. So this is the right ventricle. Okay, so your conus arteriosus is here, no? It is the upper smooth-walled funnel-shaped portion, okay, that leads to the pulmonary trunk or pulmonary artery. You also have trabeculae carneae. This is non-specific, no? Both ventricles has trabeculae carneae and papillary muscles and chordae tendineae. Okay, your trabeculae carneae, okay, is the one that looks like a sponge, no? Sponge-like appearance on your ventricular wall. Okay? You also have papillary muscles. These are cone-shaped muscles enveloped by the endocardium. Okay? So ito sila, no? So this is your trabeculae carneae, okay? The sponge-like appearance on your ventricular wall. It is continuous with the papillary muscles. Okay, yung papillary muscles. Okay, and your papillary muscles is connected to the valve through your chordae tendineae. Okay, so how does it function, no? So when you contract the ventricular muscles, okay, the papillary muscles also contract, no? So para siyang parachute, no? So pag nag-contract siya, hihilahin niya yung valve, no, towards this side, no, para hindi mag-evert yung valves natin, no, when the ventricles pump. So hindi magba-backflow yung blood. Okay? So again, the function of the papillary muscles and chordae tendineae, okay, they attach themselves to the valves, okay, so that when the ventricles contract, okay, the valves will not evert. Okay? So yun yung function nila. It prevents eversion, no, of the valve cusp during ventricular contractions. Okay, one unique feature of the right ventricle is that it has a moderator band. Okay, also known as the septomarginal trabeculae. Okay, it is an isolated band that comes from the interventricular septum, okay, and the base of the anterior papillary muscle. Okay, so asan siya? This is the septum. Okay, this is the anterior papillary muscle. So ito siya, no, the septomarginal band or the moderator band. Okay? Ano importance niya, no? It prevents overdistension, okay? And it carries the right limb, okay, of the atrioventricular bundle. Okay? So it prevents overdistension kaya siya moderator, no? Siya moderator band, and at the same time, it is a part of the conduction pathway of the heart. Okay? Specifically, the right limb of the atrioventricular bundle. So, asan siya? Ito ang septum. Okay, ito ang anterior papillary muscle. So, ito ang septomarginal band. Okay? So, now let's differentiate each chamber of the heart. Okay? Let's differentiate each chamber of the heart. So, both atria has an auricle and has pectinate muscle. Both atria may auricle, may pectinate muscle. Okay? However, your sulcus terminalis, your crista terminalis, your fossa ovalis, and annulus ovalis, okay, are only seen in your right atrium. Okay? Your sulcus terminalis, crista terminalis, fossa ovalis, annulus ovalis, right atrium only. Okay? In your ventricles, okay, both ventricles has trabeculae carneae, both has papillary muscles, and both, okay, has chordae tendineae. Okay? So what's unique about the right ventricle is that it has an infundibulum or conus arteriosus, and the moderator band, no, is only seen at your right ventricle. The moderator band is only seen at the right ventricle. Okay, differences. Okay, your right atrium, if compared to your left atrium, it is larger. It has a thinner wall and lower atrial pressure. Okay? Thin walls lang to kasi, no, mababa lang ang pressure ng right atrium. Okay? So, it doesn't need thicker walls. Okay? It is larger to accommodate the blood from the, okay, mga vena cava, superior vena cava, inferior vena cava. Okay? Your left atrium is smaller, okay, pero thicker wall, okay, than the right atrium. Okay? And compared to your right atrium, the left atrium has smoother walls, okay? Because less developed ang pectinate muscles. Your right ventricle, no? If compared to the right atrium, the walls are thicker, no? Definitely, no? Because it works under a high pressure, no? Mas mataas ang afterload ng ventricle compared to the atrium. That's why thicker ang walls nito. Okay? Pero, if the right ventricle, left ventricle pinag-contrast, the walls of the left ventricle are 3 times thicker. The pressure is 6 times higher, okay, compared to the right ventricle. Okay, again, the left ventricles has 3 times thicker walls and 6 times higher pressure. Okay, it also appears circular on cross-section, and it has a well-developed papillary muscles. Okay, in terms of location of the valves, okay, location. Sa aortic muna tayo, no? Sa aortic is located at the third ICS, left. No? Your pulmonary is located third costal cartilage, left. Your bicuspid is located at the fourth costal cartilage, left. No? While your tricuspid, okay, is located at the fourth ICS, right. Okay? Your location is different from the site of auscultation. Ha? Again, aortic, third ICS left. Pulmonary, third costal cartilage left. Your bicuspid, fourth costal cartilage left. Your tricuspid, fourth ICS right. No? So, ang right lang is tricuspid. Okay? But in terms of auscultation, your aortic valve is on the right second ICS. Okay? Right second ICS. Your pulmonary valve is at the left second ICS. Your bicuspid valve is at the left fifth ICS mid-clavicular line. Okay? So parang nasa apex, no? Apex of the heart. Okay? While your tricuspid valve, okay, is at the lower part of the sternum. Okay? Right or left, either. Okay? So auscultation ng aortic, again, nasa second ICS right. Pulmonic, second ICS left. Tricuspid, lower sternal border. Okay? Your mitral valve your mitral valve nasa 5th ICS mid-clavicular line. Okay? That's for auscultation. So in summary, okay, the location, okay, ito sila, no? Location and auscultation. Okay? Your your aortic, third ICS left. Pulmonic, third costal cartilage left. The mitral, fourth costal cartilage left. The tricuspid is fourth ICS right. Okay? So, tinatandaan ko, 3-3-4-4, ICS, CC, CC, ICS, left, 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 right. Okay? So, ganon. Ganon ka siya tandaan. Okay? Iba ang location, no? Versus auscultation. Because you can only auscultate sa ICS. Okay? Pero ang location nasa costal cartilage. Okay? So, yung auscultation, 2 to 5 lower sternal border, right, left, left, left. No? Lahat sila ICS. Okay? Lahat sila ICS. Okay? So, that's the difference between the location and auscultation of the heart valves. Okay? So, more about the valves, no? So, only your bicuspid valve has 2 valves, no? Kaya nga siya bicuspid. Okay? Your tricuspid valve has 3, anterior, septal, and inferior. Your pulmonary valve has 3 again, no? 1 posterior, 2 anterior. While your aortic valve has 3 also. Okay? 1 anterior, 2 posterior. Okay? So, bicuspid lang ang dalawa. Isang anterior, isang posterior. Okay? So, this is your tricuspid valve. Tatlong cusp. 1, 2, 3. Aortic valve, tatlong cusp. 1, 2, 3. Pulmonic valve, tatlo din. 1, 2, 3. Okay? Bicuspid lang ang dalawa. Okay? 1, 2. Okay? The features of your heart in summary. So, auricles, both atria. Okay. Meron. Pectinate muscles, both atria rin. Okay? Your fossa ovalis or foramen ovale is only seen in your right atrium. Your trabeculae carneae, your papillary muscle, chordae tendineae can be seen on both ventricles. Okay? And the moderator band is only seen in your right ventricle. Okay? Ang mnemonic ko dyan, moderator ventricle. Okay? Moderator ventricle. Okay? So, let's go to the triangle of Koch. Okay? So, the triangle of Koch, okay, it was asked no, before, no, mga 2 times na din. Okay? So, since it is a triangle, okay, ito always remember, no, yung anatomy, pag may triangle, mayroon laging boundaries yan, and meron yung content. Okay? So, the triangle of Koch, the boundaries are, ito, no, the coronary sinus orifice, okay, followed, and the right AV septal valve leaflet, okay, or your tricuspid valve leaflet, ito yan, no, tricuspid valve, okay, and the tendon of Todaro, okay, the tendon of Todaro is a tendinous structure connecting the valve of the IVC, okay, ito, no, the valve of the IVC, di ba, eustachian valve, okay, to the central fibrous body, okay, that is the tendon of the Todaro. So, ito ang triangle mo ngayon. Tendon of Todaro, coronary sinus orifice, and the right AV valve septal leaflet. Okay? What's the clinical importance? Okay? At the apex of the triangle of Koch, okay, that's where we can see the AV node. Okay, the atrioventricular node. Okay, so that's the content of the triangle of Koch. Okay, so let's go to the blood supply of the heart. Okay, so the blood supply of the heart, okay, is coming from the ascending aorta. Okay, from the branches of the ascending aorta. Okay, and they are filled during ventricular diastole. Okay, they are filled during ventricular diastole. So let's go first with the right coronary artery. Your right coronary artery arises from the anterior aortic sinus, okay, of the ascending aorta. Okay, running between the pulmonary trunk and right auricle and descends on the right coronary sulcus. Okay? So asan si right coronary artery? Ito siya, no? Okay, right coronary artery. Okay, so yeah. So what are the branches of your right coronary artery? Okay? First, it has a right conus artery to supply the pulmonary conus. It has an anterior and a posterior ventricular branches, okay, to supply the right ventricle. Okay, and importantly, the posterior interventricular artery or your posterior descending artery. Okay, so this artery will supply both ventricles, right and left ventricles. Okay, and it will also supply the posterior half of the ventricular septum. Okay, again, posterior ventricular artery or posterior descending artery, both ventricles and the posterior septum. It also has atrial branches, okay? What's important here, okay? The artery that supplies the SA node is coming from the right coronary artery, okay? The artery that supplies the SA node is coming from the right coronary artery. Okay, so ayan siya. Okay, the right coronary artery. Okay. The left coronary artery, on the other hand, okay, is coming from the left aortic sinus of the ascending aorta, okay, between the pulmonary trunk and the left auricle. It is usually larger but shorter, okay, and supplies the major part of the heart, okay. So your left coronary artery is here, okay, left coronary artery. It has two main branches, the left anterior descending, okay, and the left circumflex artery. Okay? The left anterior descending, the left circumflex artery. So your left anterior descending or the anterior interventricular artery, okay, para siyang posterior interventricular artery, no? It will supply both ventricles, okay? And on the other hand, this one, the anterior, okay, will supply the anterior septum. Okay? And your circumflex artery will supply the left side of the heart, the left atrium and the left ventricle. Okay? So that is the blood supply of the heart. So merong question before, no, sa ating board exam, what artery supplies the right and left ventricles? So ito, no, the left anterior descending artery, saka si posterior descending artery. Okay? Both of them will supply the right and left ventricles. Ayan, nakita na natin. Okay? So, after the blood supply, okay, let's talk about the venous drainage. Okay? The venous drainage of the heart is mainly coming from the coronary sinus. Okay? It is the largest vein that drains the heart. Okay? That it lies in the coronary sulcus, which separates the atria from the ventricles. Okay? It opens into the right atrium. Okay, and it will receive the great, middle, small cardiac veins, the oblique vein of the left atrium, and the posterior vein of the left ventricle. Okay, so this is your coronary sinus. Okay, so great cardiac vein, diretso dyan. Okay, this is your oblique vein of the left atrium. Okay, so your coronary sinus will drain to the right atrium. Okay, another picture. This is the coronary sinus. This is the oblique vein. This is the great cardiac vein. Okay, this is the posterior vein of the left ventricle, the middle cardiac vein, and the small cardiac vein. Okay, all of them draining into the coronary sinus, okay, to eventually open into the right atrium. Okay, now, so let's go to the one important muscle in your thorax, okay, which is your diaphragm, okay. Your diaphragm anatomically, okay, it separates the chest cavity in your abdominal cavity, okay. It is physiologically, it is the most important muscle of respiration, okay. It is dome-shaped, okay, in appearance, okay. So this is your diaphragm, okay. Okay, so your motor supply, again, it is coming from the phrenic nerve, no? From the cervical plexus. 3, 4, 5 keeps the diaphragm alive. Okay, in terms of sensory supply, okay, it's supplied by the phrenic nerve, okay, on the central surface, while the periphery is coming from the lower 6 intercostal nerves. Okay, for the blood supply, it is supplied by the superior phrenic arteries, musculophrenic, pericardiophrenik arteries and veins, okay, and inferior phrenic and arteries and veins. Okay, for the diaphragm, the openings, we have 3 openings. This is actually very important. Laging tinatanong, no? So you have 3 openings, the caval opening, esophageal opening, aortic opening. Okay? Ang mnemonic lang natin naman dyan, no, is CEA 8, 10, 12. Okay? CEA 8, 10, 12. Okay? The caval opening is at the level of T8. Esophageal opening is at the level of T10. The aortic opening is at the level of T12. Okay? So the caval opening allows passage of the inferior vena cava. Okay? Kaya nga siya caval opening. Okay? However, hindi lang yun yung tinatanong, no? Ang tinatanong na ngayon, sino ang kasama ng inferior vena cava? Okay? So ang kasama niya is the right phrenic nerve. Okay? So inferior vena cava and right phrenic nerve pass through the caval opening at the level of T8. At the esophageal opening, okay, so it allows passage of the esophagus together with the vagus nerves, okay, and the left gastric vessels and lymphatic vessels, okay. So that lies at the level of the T10, okay, T10. While your aortic opening, okay, at the level of T12, okay, allows passage of the aorta, okay, at the same time the thoracic duct and the azygos vein. Okay, so going back to the picture, okay, so this is the diaphragm. Okay, ang pinakamataas, CEA 8 and 12, caval opening. So this is the inferior vena cava. Okay, at the level of T8. This is the esophagus at the level of T10. Okay, this is the aorta at the level of T12. Okay, dito lang napakita yung mga kasama niya, no? Si thoracic duct, saka si azygos vein. Okay, at the level of T12 aortic opening. Okay, so now let's go to the esophagus. Okay, since we're talking about the esophageal opening, let's talk about the esophagus. It is a tubular structure around 10 inches long, no? Kasama siya dun sa mnemonic nating dudes, no? Yung dudes with 10 inches. So it starts at the level of C6, cervical vertebra, okay, and ends at the level of T10, thoracic vertebra, okay? T10, no? To eventually join the stomach. Okay, so this is your, C6 level. Okay, C6, and then this is your T10, no? Once it passed through the diaphragmatic opening, again, anong level ng esophageal opening? At the level of T10, no? So at the level of T10 lang siya, eventually it will join the stomach. So your esophagus has 3 constrictions, okay? Upper, middle, and inferior, okay? So your upper or pharyngoesophageal constriction is at the beginning, okay? At the level of C6, okay? And it is a constriction because of the cricopharyngeus, Okay, so yung mga important tong constriction because of the foreign body, no? So usually, ayan, minsan nandito pa natin siya nakikita, no? Sa level ng C6, no? Cricopharyngeus. Because it is the narrowest, no? Narrowest part of the esophagus. Okay, pag mga nandito pa, no? Refer to ENT pa, no? Okay. So next, the middle or thoracic constriction, okay, is at the level of the aortic arch, okay, and the left main bronchus, no? Where the aortic arch crosses the left main bronchus. And the last constriction is at the level of inferior or diaphragmatic constriction at the esophageal hiatus at the level of P10. So this is the upper constriction, okay, at the cricopharyngeus. Refer to ENT, no? Pag nandiyan ang foreign body, no, ang piso. Pag andito, no, ayan, this is the middle constriction where the aortic arch crosses the left main bronchus. Ayan. Refer to ENT pa din. Okay? Pag nandito, okay, nasa lower esophageal constriction, ayan, at the level of T10. Okay? That's the last constriction of the esophagus. Refer to ENT pa din, no? Pero minsan, ino-observe na lang, no? Baka bumaba na. Okay? And then eventually, ipoops niya na lang yung foreign body. Okay? So those are the 3 constriction of your esophagus. Okay? Aside from 3 constriction, meron din siyang 3 blood supply, 3 venous drainage, and 3 lymphatic drainage. No? Iba-iba. Bawat third ng esophagus mo ay iba ang supply. Okay? Your upper third, okay? Okay, the blood supply, venous drainage, and lymphatic drainage, okay? Nakikishare lang siya sa neck, okay? So, the upper third is supplied by the inferior thyroid artery, drained by the corresponding vein, okay? And drained by the deep cervical lymph nodes. So, nakikishare lang siya sa neck. Yung middle third, nakikishare naman sa thorax, okay? It's supplied by the thoracic aorta, drained by the azygos veins, okay? And the lymphatics are drained by the superior and posterior mediastinal lymph nodes. While yung lower third, nakikishare naman siya sa abdomen. Okay? So, esophagus mo nakikishare lang sa lahat. No? Okay? So, lower third, okay, the blood supply is coming from the left gastric artery. Okay? Venous drainage to the left gastric vein to the portal vein. And lymphatic drainage to the left gastric and celiac lymph nodes. So this is your esophagus, ano? The upper part, okay, coming from the inferior thyroid artery. The middle part coming from the aorta. And the lower part is coming from the left gastric artery. That's your esophagus. Okay? So now, let's go to your major vessels in the thorax. Okay? Okay, specifically the aorta. Okay? So let's start with the ascending aorta. Okay? It will come from the base of the left ventricle. Okay? And runs upward and forward behind the sternum. Okay? And it will end at the level of the sternal angle, no, to become the arch of aorta. Okay? As mentioned earlier, the ascending aorta is located in the middle mediastinum. Okay? And the 2 branches were already mentioned, no? The right coronary artery and the left coronary artery. Okay? So this is your ascending aorta together with its branches, no? The right coronary, the left coronary artery. Okay? So next is the arch of the aorta, no? Lying behind the manubrium. It arches over the right pulmonary artery and the left main bronchus. Okay? And passes downward at the level of the sternal angle. Okay? This time, your arch of aorta is at the level of the superior mediastinum. No? And the branches were already discussed. No? The brachiocephalic artery, the left common carotid artery, and the left subclavian artery. Okay? So this is the arch of aorta. You have the brachiocephalic artery, which gives off the right subclavian and the right common carotid artery. Okay? And then another branch, the left common carotid. Okay? And the last branch, the left subclavian. Okay? So, the arch of aorta is followed by the descending thoracic aorta, which lies in the posterior mediastinum. Okay? Again, it begins at the T4, no? Level ng sternal angle. Okay? It begins at T4 and ends at the level of T12, no? So, pag nakalabas na siya ng aortic hiatus, magiging abdominal aorta na siya. So, these are the branches: posterior intercostal arteries, subcostal arteries, pericardial arteries, esophageal and bronchial arteries. So, this is the descending thoracic aorta. Okay? So, yung branches, esophageal, the bronchial arteries, ayan, the mediastinal arteries, posterior intercostal arteries. Okay? And the subcostal arteries. Okay? So, those are the branches of your thoracic aorta. Okay? And again, as it enters the aortic opening, okay, at the level of T12, it will become the abdominal aorta. And at the level of L4, okay, L4, it will bifurcate, no? L4 bifurcate to two common iliac arteries. Okay? So what are the branches? Okay? You have three anterior visceral branches, okay, namely the celiac, superior mesenteric, and inferior mesenteric arteries. You have three lateral branches, lateral visceral branches, which are your suprarenal, renal, and the gonadal arteries. You have five lateral abdominal wall branches, okay, which are your inferior phrenic and the four lumbar arteries, and three terminal branches. Okay, you have two common iliac and a median sacral artery. Okay, so isa-isahin natin. Okay, the anterior visceral branches, we have three: celiac artery, superior mesenteric artery, inferior mesenteric artery. Okay, you have three lateral visceral branches. Okay, you have the you have the you have the suprarenal artery, right and left. You have the renal artery, right and left. You have gonadal artery, no, right and left. You also have five lateral abdominal wall branches. Okay, the lumbar arteries, apat, four pairs, and the inferior phrenic artery. Okay, inferior phrenic artery. And the terminal branches, which are your common iliac arteries and your median sacral artery or your middle sacral artery. Okay, so those are the branches of your abdominal aorta. Okay, so after we've discussed the blood supply, arterial supply, let's discuss the venous drainage system, no, of the thorax. Okay, so you have the azygos system of veins, no? System siya, no? Because it is comprised of several veins, no? It lies on each side of the vertebral column and drains the back, the thoracoabdominal walls, and the mediastinal viscera. Okay? So first off, we'll start with the azygos vein. Okay? The azygos vein. It is formed by the union of the right ascending lumbar vein and the right subcostal vein. Okay? Important to remember right, no? Kasi meron mamayang left, no? Right ascending lumbar, right subcostal vein. Okay? It will start at the IVC and it will empty at the SVC. Okay? So it connects the inferior vena cava and the superior vena cava, thereby giving a collateral pathway between the two veins. Okay? Tinanong na yan before, no? Which vein serves as a collateral pathway between the SVC and IVC? That is the azygos vein. Okay? Azygos vein. And remember, no? Saan siya dumadaan? Sa mga opening, okay? Sa aortic opening, no? At the level of T12. Okay? It is also the vein that arches over the root of the right lung. So if you have tumors of the right lung, okay, specifically at the root part, no, na-affect si azygos vein. Okay? Some tributaries, okay, the 8 lower right intercostal veins, the right superior intercostal vein, superior and inferior hemiazygous veins, and the mediastinal esophageal bronchial veins. So, asan siya? Ito siya, no? Hindi kita yung IVC, pero ito siya, no? It will arch over, no, the right main bronchus. Okay? Or the root of the right lung. So, ito siya. Okay? To connect to the SVC. Okay, so that's the azygous vein. Okay, so azygous vein in this picture, asan siya? Ito siya, no? This is the IVC. Ayan, ito azygous vein. Ayan, the IVC. Okay? Ayan, okay? So on the other hand, okay, your azygous venous system, asymmetrical siya, no? Okay? Not necessarily, no? Parehas sila ng mga pathway, no? Okay? So, on the left, okay, you have the hemiazygous vein. Okay? Hemiazygous vein. Okay? This time, it is formed by the union of the left subcostal vein and the left ascending lumbar. Okay? Familiar? Pag right, azygos. Pag left, hemiazygous. Okay? So, this time, the hemiazygous vein comes from the renal vein. Okay, so from the renal vein, asan siya? Ito ang renal vein. So, ito ang hemiazygous vein. Okay? Ayan. So, it will receive the 9, 10, 11 and the 9, 10, 11 posterior intercostal vein. Okay? Actually, pati 12, no? The subcostal vein. So, yan ang mga i-receive niya. Okay? So, this is the hemiazygous. Okay? So, coming from the renal vein, it will receive 8, 9, 10, 11, 12. Okay? And then eventually, ko-connect sa azygous vein. Okay? So, that's hemiazygous. Next, your accessory hemiazygous vein. Okay? Ito naman tong group na ito, no? Your accessory hemiazygous vein, okay, will receive 4th or 5th to 8, no? So, 5, 6, 7, 8. Okay? And eventually, will turn to the right. Okay? And terminate ulit sa azygous vein. Okay? Si azygous lagi ang sumasalo ng lahat, no? Okay? Next, your superior intercostal vein, you have a right and you have a left. Okay? Your superior intercostal veins will receive the 2nd, 3rd, and 4th, no? 2nd, 3rd, and 4th. Okay? However, magkaiba sa right and left. Si right, okay, si right magde-drain sa azygos, no? Si right sa azygos. Si left, magde-drain sa brachiocephalic vein ng left. Okay, dadiretso na siya. Okay, gets pa natin? Si right superior intercostal vein sa azygos. Si left sa brachiocephalic vein. Okay, and lastly, your posterior intercostal vein, okay, the first one, ito, no? The first intercostal vein, it will drain directly to the brachiocephalic vein, both right and left. Okay? So, diretso na sila. Right and left. Okay? So, in short, your first is drained by the posterior intercostal vein. Diretso, no? Magdi-drain sa brachiocephalic veins. Okay? Sa second to fourth, okay, superior intercostal veins. However, si right, magdi-drain sa azygos. Si left, magde-drain sa brachiocephalic vein. While your 5th to 8 and 9 to 12 on the right is drained by the azygos. Your 5th to 8 on the left, okay, is drained by the accessory hemiazygos, which will eventually magde-drain pa rin sa azygos vein. Okay? While your 9 to 12 is drained by the hemiazygos, okay, which will eventually drain pa din sa azygos vein. Okay? So, that is the azygos system of veins, no? And going to the lymphatic system, okay, so you only have two structures to remember. The thoracic duct and the right lymphatic duct. Okay? Your thoracic duct, okay, it will begin at the cisterna chyli, okay, which is a dilated sac in the abdomen. Okay? Naalala, si thoracic duct magpapass through sa aortic opening, no? Level of T12 together with the aorta and azygos vein. And then it will arch over the apex of the left pleura and eventually will empty at the left internal jugular and subclavian vein junction. Okay? So, it will drain at the left internal jugular and subclavian vein junction. Okay? What's important, okay, are the structures that it drains. Okay? So, it basically drains the lower limbs, both the pelvic cavity, the abdominal cavity, okay, the left side of the thorax, the left side of the head and neck, and the left arm. So, majority of the lymphatics are drained by the thoracic duct. Ayan, okay? In this picture, ito ang thoracic duct, yung mga, yan, dinidrain niya yan. Okay, the thorax, the abdomen, ayan. And the left side of the body. Okay? Your right lymphatic duct, on the other hand, will drain the right side of the head and neck, right side of the upper limb, and the right side of the thorax. Okay? It opens into the beginning of the right brachycephalic vein. Okay? In some references, however, in some references, it will empty in the right internal jugular and subclavian veins. Okay? So, this is your right lymphatic duct, no? Maliit lang siya. Okay? While your thoracic duct, ito siya, no? It will begin at the cisterna chyli. And it will ascend sa aortic hiatus together with the azygos vein and the aorta. Okay? And then, eventually, magde-drain dun sa junction, no? Ng subclavian vein and the internal jugular vein. Okay?